We are proud to partner with them in providing the venue, and having this conversation is the first step in demystifying this sensitive subject and making it the priority it should be for all of our communities. So here's to a healthy discussion. At this point, I'd like to introduce the president of Des Moines Register, David Travers.
Thank you, everyone. First, I'd like to thank all of you for joining us tonight on this important topic. I'd also like to thank DMU, especially Dr. Franklin, Sue Hubbard, and the team for being excellent hosts this evening. I'd also like to thank our sponsor, the Iowa Hospital Association, for their generous support of tonight's event. And lastly, I'd like to thank all of the candidates tonight for this really, really important topic. And I'd like to recognize Kathy particularly for her column and organizing the forum that's especially focused on mental health. I would like to, at this point, introduce Mary Neubauer and her husband, Larry Loss. Do you mind standing up? It was Kathy's friendship with the family and Mary's touching obituary about the death of their 19-year-old Sergei that really prompted this conversation that we're going to have tonight. Mary had courageously written about Sergei's struggle with mental illness and Iowa's lack of adequate mental health resources during Sergei's times of crisis. And there are a number of folks like Sergei, both that are no longer with us and that are struggling day to day right now. And I'd just like to take just a moment of silence to recognize folks we've lost and folks who are struggling with mental illness. Thank you for that. I would also like to recognize Tony, who is one of our moderators tonight. He has long written about mental health care during his work as the Register's healthcare reporter. He and the editors at the Register, I'm very happy to say, are planning to devote considerable space in 2018 to this topic. It is one that, again, for folks who are struggling with mental illness, critically important, but I would argue, as citizens of our state, an issue that we know we can do better as a state, on a state level. So thank you for joining us. As I said, this is a critical topic for our state and for our community, and I hope this is just the first of many conversations to come on what is just a critically important topic. Thank you very much.
All right. Thank you, David. I'm Kathy Obradovich, political columnist for the Register, and I will serve as your moderator tonight along with Tony Lays, the Register's reporter on healthcare issues. Here's how tonight's forum will work. Tony and I will take turns asking questions. Candidates will have a time limit of 2 minutes for the first question and 1 minute after that. We will reframe the questions after a few of you have answered, so listen carefully. Tony and I also may ask follow-up questions at our discretion, but because there are a lot of you here, which is great, we're going to keep the time limit very short for any follow-up questions. Our timekeeper, Anna, is in the front row, and she'll let you know when you have 15 seconds left, and she'll raise another card when you need to stop, and thank you very much in advance for respecting the time limits. For the audience, I know you've been thanked a lot already, but thank you again so much for being here. Because we have, again, so many candidates, we have provided biographical information in the program. So we're going to dispense actually with introductions tonight. We're just going to get right into the questions. And I also have to ask a couple of favors from you. First of all, please refrain from applause or making noise during the forum. I know that's hard because we're all excited, but we don't want to take time away from the candidates. Secondly, Des Moines University has kindly provided three licensed therapists who are in the back of the room, right back there. See them waving. And if anybody feels like they need to talk to somebody either during or after the forum, just catch their eye. You can leave at any time during the forum, just catch their eye on the way out, and they'll come and find you. We just ask that if you do leave, at any time during the forum, please do so quietly. All right, so let's get started. First of all, we are going to have a video from Governor Kim Reynolds, who was unable to attend tonight because of a schedule conflict. And so once we finish with the video, then we will get right into questions. Okay. All right, try that again. They're counting on my technical skills here.
Let's see what I can do. I can act it out.
Good evening. First, let me apologize that I'm not able to join you, but I really do appreciate the opportunity to discuss the pressing issue of mental health. I'm Governor Kim Reynolds, and as a mother, it pains me to hear the stories from Iowans and their families struggling with mental health challenges. My administration has taken a number of steps to address the critical mental health needs in our state. Today, Iowa's mental health system is serving more Iowans in more modern ways with better services in more local home and community settings than ever before. With Iowa's 14 regionalized state and local partnerships, no matter where Iowans live, they will receive the same core mental health services. Connecting Iowans with early treatment options like jail diversion programs is so critical. Over 5 years, we've expanded access to jail diversion programs from 11 to 81 counties. We're covering over 150,000 more Iowans than we did in 2013, and our mental health care investment has increased by $500 million to $2 billion, which is a 33% increase over the previous 5 years. It's why Mental Health America named Iowa a top 10 state for mental health care, and that's up 6 spots since 2011. But there is more that we can do and will do to ensure that all Iowans are receiving the care that they expect and they deserve. We must do everything we can to raise the awareness of mental health and the resources that exist, connect people with preventative and early treatment options, and continue modernizing a mental health system for the 21st century. I appointed Jared Foxhoven as the new director for the Department of Human Services and specifically instructed him to find ways to do everything he can to protect vulnerable Iowans. And he's taking this role very seriously, updates me often, and we are committed to ongoing improvements as we build a better mental health system in Iowa. So thank you again for the opportunity to share our story, and I look forward to working with you as we continue to improve mental health in the state of Iowa.
Okay. Now, our first question will go to all the candidates, so we're just going to run down the line here. You guys are seated in alphabetical order, so we're going to start here with Marco Battaglia. What do you see as the most pressing problems in Iowa's mental health system, and what would you do as governor to fix them?
I see as the most pressing problem that we treat so many people suffering from mental illness as criminals, and I think that is where we have to start. I think that my platform really addresses this issue really on every line of my platform, be it medically, even agriculturally and economically. I think that people really, we spend a lot of money, and a lot of people that need help or that are going through the right avenue they have to wait, and we spend more money because there's people in being gone through the court system, going to jail, getting arrested just because they're doing something. If anything, they're only hurting themselves. And I really think unless we rein in the war on drugs, we're really just running around in circles. We've been saying a lot of nice things for 50 years, 100 years, and I was really inspired to run by former Iowa Governor and Senator Harold Hughes, and he would sit there in his office and talk about this issue that he saw coming, and he would talk about the youth and talk to young Iowans that are younger than we even think of that were suffering from heroin addiction, and as young as 12 and 13. And we can do a lot of talk, but unless we start actually acting and doing some major changes, not much is going to change, I'm afraid.
Thank you. Nate Bolden, what problems do you see as most pressing in Iowa's mental health system, and what's your plan to fix them?
Thank you, Kathy, and again, thank you for putting together the forum. These are important issues that we do need to have a lot of attention on. And one of the critical problems that I can see right now is the fact that we just had an address of a video from our governor who doesn't seem to acknowledge that there's much of a problem here. Talking about progress and talking about things are going well doesn't replace the fact that we have a serious mental health crisis in this state. And we need to have serious conversations about answers to that crisis. As we look at some of the key problems that we're facing right now, Medicaid privatization, this system is failing in mental health care. It's a system that's not working for patients who are struggling to obtain mental health services in a timely manner and navigate a system that continually resets and resets on them. It's not working for providers who are seeing delays and denials in their reimbursements, who are struggling to find ways to maintain their level of services while their budgets are being ruined by these delays and denials in the reimbursement process. And it's not even working for the managed care organizations, as we're seeing the results of the fractures in this system causing managed care organizations to pull out of this system. The other real threat is simply a mismanagement of our state's budget. As a result of an overblown system of corporate tax credits, exemptions, and giveaways, we are starving critical agencies, departments, and providers of resources they need to be able to actually provide care and services. We've seen 2 of our state's 4 mental health institutes shut down. Nothing done to replace the lost services, nothing done to replace the lost bed space. The real problem is that access in this system right now is only for those who have the means to obtain access. We have to fix that. Iowa is better than this.
Thank you. Kathy Glosson, I guess we didn't quite get you in alphabetical order, did we? So we're a little out of order there, but go right ahead. Thank you.
Okay. Hi. Thank you so much. As governor, I came out bold and progressive on supporting a Medicare for all system on a federal level. And if we can't count on the politicians in Washington, D.C. to do the right thing, I believe we need to fight and work to pass a universal single-payer health care plan right here in Iowa, everybody covered, no one left behind. In that system, mental health services, pharmaceuticals, substance counselors, and abuse all would be treated under a single-payer plan, and costs would be reduced. Immediately, what we need to do is reverse the damage to the privatization of Medicaid in this state, which has been devastating to so many families and providers in the state. We need to also fully fund the Department of Human Services. We've seen what the cuts in DHS have done to making sure and monitoring that our children and those most in need in mental health services are taken care of. And also we need to enhance crisis stabilization centers from the 14 regions around the state so that when there's emergency situations, even in rural communities, which is most in need for mental health services, the citizens and folks that need the mental health treatment have access to those, as well as incentivize and provide opportunities to attract and retain highly qualified professionals in mental health services, counseling, substance abuse, and beyond. And we also need a stronger integration between the Iowa Department of Public Health, which treats substance abuse separately than under the Department of Human Services, which covers the mental health coverage of the state. We need to take a look at a more fully integrated, coordinated, and collaborative sort of umbrella organization to make sure that the health care for all Iowans and the mental health services that they need and deserve are run effectively and cost effectively, yet providing the highest quality mental health services to our citizens.
Thank you. Ron Corbett.
Thank you. My name is Ron Corbett. I announced that I was running for governor on June 20th of this year, I announced a new game plan for the state of Iowa because the status quo just isn't getting the job done anymore. Part of that 4-point game plan, the first point was modernizing our income tax system to make our state more competitive. The second point was to focus on water quality, to clean up our water efforts so we don't have lawsuits and big EPA regulations. The third was supporting K through 12, equipping principals, making sure our teachers' salaries don't slip the last in the country, and providing innovation in the classroom. And the fourth was showing concern for people. And in that fourth point, I got elected as mayor in 2009 after the flood of Cedar Rapids. We were devastated by a flood. You don't get elected mayor if you don't show support and concern for people. And that's why I highlighted it as one of my bullet points for a new game plan for the state of Iowa. And mental health comes underneath that bullet point. There are 5 or 6 areas that need to be addressed, Kathy. The first one is because of the closure of the mental health facilities in Clarinda and in Mount Pleasant and the juvenile home for girls in Toledo, there's been a compression in the system. See, the state may have saved some money on their line item, but the people didn't evaporate. They just got compressed in the system, and we're seeing that manifested. And sometimes it's homelessness, and sometimes it's in the jail, as people have said, and just sometimes it's overcrowding in our hospitals. The second thing is the system is too fragmented. There isn't a lot of coordination, and just for a quick example, mental health services are in the Department of Human Services, where you have substance abuse treatment dollars are in the Department of Public Health.
Okay, thank you. Before we go on, some of you may still have your mics on. If you're not speaking, just check your little green light. We get a little echo here. Thank you. Mr. Hubble.
Thank you. Well, I think the biggest problem is we need to be upfront and admit we have a crisis in mental health and substance abuse in our state. Despite what you just heard, we do not have a modern system and we do not have an efficient system. We're a long ways from both. I've been traveling around the state a good deal. I had 10 separate meetings on mental health all across the state, whether it's in people's homes, in police stations, in jails, community service offices, all across this state. Mental health comes up in every single topic when I have a meeting, every single time it comes up. And nobody has an answer except they'd like a lot more support, they'd like a lot more recognition of the problem. I'm not going to list all the issues. I'd like to talk about some of the suggestions that I have to try to help this situation. First of all, let's recognize there is no single solution. Mental health shows up differently in every family, in every neighborhood, in every community. We need to emphasize community-based solutions, not top-down. On the other hand, we do need more beds. We need roughly 50 to 75 more acute long-term care beds because the governor and her predecessor closed 2 facilities. At the same time, we don't have enough psychologists, we don't have enough psychiatrists, we don't have enough trained clinicians to help in these issues. We're going to need to incentivize more of them to get the training, and we're going to need to incentivize more of them to stay in Iowa once they get trained. At the same time, we need to have more coordination between the Department of Public Health and the DHS services. One does mental health, one does substance abuse, but we all know oftentimes they are co-occurring, and it's very difficult to treat them both at the same time when they come under different leadership. We have no youth program for mental health in our state. That's unacceptable. We need a youth program for mental health, just like we have one for adult mental health. And we need to provide better support for law enforcement, because a lot of their time and effort is now spent dealing with mental health issues, not providing public safety. So we need to help them get more time for their 2 jobs, helping with public health, but also dealing with public safety. Thank you.
Thank you. Andy McGuire, your plan and what you think the biggest problems are.
Well, thank you, Kathy. My entire life as a physician, I've spent dealing with problems of mental health and substance abuse and addiction. And I've been going to all 99 counties, and I've been talking to families who have tragedies in them because of our mental health problems we have right now. We're losing our kids, and this is just unacceptable. So that's why I think one of the biggest problems we have to face is facing that mental health, substance abuse, and addiction are a disease. As a doctor, this is a disease. It's not a character flaw. It's not a problem with a person. It's a disease, and we need to treat it as such. You know, we right now are incarcerating people who have a disease. Think if someone walked in here and they had a broken leg, they were on crutches. We'd all get up, we'd all help them with the door, we'd get them their chair, we'd get them a pillow on that other chair, we'd do anything we could, get them a drink. But they walk in here and they've got a depression issue, or they have a substance abuse issue, and we may take one step backwards. That's the biggest issue we have to face right now, and I will lead on that issue. That's why I put out a 7-point plan on how I intend to have short-term and long-term solutions to how we deal with mental health, substance abuse, and addiction as the disease it is. We have got to take this extremely seriously. And I don't know what state she's living in, but it's not the state I'm living in.
Thank you. John Niederbach.
This is a very difficult and personal issue. When we have a moment of silence before, I was quickly running through the number of people I know who have died from substance abuse or suicide. It's got into double digits real quick, and I'm sure it's a lot higher than that. It's also so painful because it's not an issue that just happened. This is an issue that we are in the mess we're in because of decades of incompetent leadership. This isn't a partisan issue. This is a bipartisan issue. No matter what administration we've had, both in Des Moines and Washington, we have not been willing to directly confront the problems involved here. I don't disagree with any of the specifics that have been said already and probably will be said. But we have to look at the systemic roots of this. Big pharmaceutical companies have led us terribly astray, and the medical establishment has led us terribly astray. And frankly, as voters, we have led the government terribly astray by not being willing to pay for services that are needed. In terms of problems, obviously, availability, accessibility, quality are all in very bad condition. In a word, what we need is parity with the physical health system. There should be no difference, as has been said before, when somebody presents with a mental health problem or a substance abuse problem. But we have to, as we think of solutions, also look at the root causes and be willing to directly confront all the people who will fight us as we change the system.
Thank you. John Norris, biggest problems you see and your plan to fix them.
Thank you. Well, I think Governor Reynolds gave us a good example of the use of telemedicine as part of the integrated effort. But we need a governor that doesn't beam in on this, but one that shows up and works every day. Our biggest problem is our leaders aren't listening to Iowans. I watched the outpouring of support from Mary and Larry. You heard about the Bondurant case with the Nicholsons. They were crying for help, and even afterwards, the community pointed out we'd failed. I think back to Parkersburg and Coach Thomas and the Becker family, who fought for years for help for their son. But it was the outpouring of support in that community for both families, the Thomases and the Beckers, that spoke to Iowa values about caring for each other. It's time we have government leaders who used that example of caring of Iowans to lead on this issue. And we have, first of all, a failure of leadership. To fix this problem, first, end the privatization of Medicaid. Commercial MCOs will never be motivated for health care first. Need to admit failure. The governor needs to admit failure. That's a part of being a leader. Secondly, we need to have a strategic plan, not just another board and commission, which the state has many of. This goes beyond that. But with experts who develop a strategic plan with oversight of our regional mental health facilities and services. And then a budget so the spending matches that plan. And empower our counties and the regional systems to have a levy rate to meet their budget needs. That's a start. And then we have to have a continuum of services, from inpatient beds to community-based care, that can begin to identify the Nicholsons and the Beckers and the Sergeys of this world and not let them fall through the cracks.
Thank you. Jake Porter.
Well, first of all, thanks for having me. I'm not going to disagree with anything that's been said so far. There are so many issues that the state faces, you know, whether it be the budget cuts, the Medicaid privatization failures. But I think the biggest problem that we have to look at is the stigma that surrounds it. And I'm glad that the work that you've done and that people that have written the articles about this discuss that mental health is a real concern. It impacts a lot of people. It impacts all of us in some way or another. I have, you know, it's a personal issue for me, and I'm very glad that we have the opportunity to discuss it. I don't like to talk about it, but years ago I contemplated suicide. I thought about it. I was going to do it. And I went on a long drive, and I, at the last moment, decided not to. It was a real spiritual experience. It's not fun to talk about this stuff. We don't like to talk about it. We like to kind of gloss over the issues. And there's only one of us on this stage that will probably be the next governor. But we have to ask ourselves, we all need to work together no matter who wins. Everyone in the audience also needs to work together. We need to reach out to our neighbors, our friends that are in need. Ourselves, whenever we have problems, we need to admit that we've got a problem and seek help for it. And there's all kinds of things that we can do within the legislative process as well, whether it be making sure that budget cuts are not impacting mental health. Budget cuts are not impacting, whether it be, you know, the sexual abuse hotlines that we've got that ultimately lead to more problems, or also looking at the policies we've got for our drug policies. You know, as Dr. McGuire said too, about if somebody came in here with an addiction, would we look at them the same way as somebody with a broken leg or a broken arm? Those are things that we all need to look at. But I think none of this is going to change until we address the stigma behind discussing mental health.
Thank you. Stephen Ray.
Thank you for having me here tonight. To begin with, to me the biggest issue is that we have to confront first is that the state of Iowa has failed miserably the citizens of Iowa. And, you know, I come from a background in law enforcement and public safety. I worked in it for nearly 30 years. And I can tell you that I started seeing this 30 years ago. We would have requests for committals through the sheriff's office where I started out at, and we were often finding, even back then, that it was difficult to find a bed in this state. Sometimes deputies would have to drive 150 miles to find a bed, and that's inexcusable. So, as Jake had mentioned, one of the key issues that I think we have to do beyond all the things that are kind of well known. I mean, we obviously have to pay for to improve this situation. But the fact of the matter is that even though there might have been a line item savings for shutting down 2 state mental institutions, you're all still paying for this anyways. This is all borne back to the locals. So when the state says, you know, that they're saving money here, that they have to save money, it's not saving taxpayers any money. It's all going back to the locals. And that's where the sheriffs, their budgets are bloated because they're dealing with this. We're dealing with the mental health crisis in this state through the criminal justice system. What is wrong with that? That is just ridiculous. That is not where this should be dealt with, and our law enforcement people are not mental health specialists. So we have to bring this back to make sure that we educate. We have to educate the public to know that there is nothing shameful about mental illness. The only thing shameful about it is not talking about it, just like any other disease. Thank you.
Thank you. Brent Roski.
Well, it's entirely possible through the algorithms of the internet that someone watching this right now, either live or 10 years from now, may be having a mental health crisis as they watch this. So I wanted to offer the suicide prevention hotline. It is 800-273-8255. It's not weakness, but strength to ask for help when you need it. This is the newspaper from Friday. It says Medicaid firm care won't be affected. Well, I read this at my job at 5:45 in the morning. I work with adults with developmental disabilities, many of which also have mental health issues. I read this as I watched caseworkers who had jobs for 10 years be escorted to the door. They were laid off. I read this as over 100 of the consumers that we help care for could no longer receive our services to get them from their houses to their daycare programs and from their work training programs. Due to HIPAA laws, I'm not going to state any names, but here's an email that we got that day. We had 3 changes in about a week and a half with his MCO changes and just got word yesterday that at least through December he'll now be with DHS. Crazy stuff going on. The subheadline for this article is more on point. It's a mother says it's just been a confusing nightmare. The MCOs, they're called managed care. I call them managed chaos. The governor mentioned jail diversion programs. I'll tell you another quick story. This summer, I was working as a direct service provider for adults with developmental disabilities. I got a call. My wife said someone's stealing the furniture off the front porch. I got there, a Des Moines police officer and my wife were standing there, and the gentleman was still there, and the officer said he should be in a mental health program, but there's nowhere for me to bring him right now. So I don't know what program she's talking about. And I said, well, I just came from my job where I deal with folks like this. So I had a conversation with the gentleman. I gave him a cup of water, and he walked away into the neighborhood, we assume to someone else's problem, sadly. Finally, I'll say I agree with Kathy. This country is ready for single-payer health care. 700,000 Americans file for bankruptcy every year due to medical costs. If you add up Canada, the UK, Germany, France, Spain, Australia, 0. They don't have any medical bankruptcies. This issue, mental health, is as urgent as a fire at your neighbor's house. We need to solve it. We need to solve it now.
Thank you. And Ross Wilburn.
Well, good evening, and thank you all for being here this evening. I think our presence here in this topic shows that we need to shift our thinking that anything we put into investing in our people really helps with mental health care services and support the untapped potential that we are denying ourselves as a state in our youth and our adults. We need to recognize that it's going to take multiple solutions and multiple answers. I remember my time as a youth worker at United Action for Youth in Iowa City as the director of the Crisis Center of Johnson County and with the K-12 education system, that historically we have viewed many issues as the flavor of the month. And we need to look at a more comprehensive way in terms of treatment, intervention, prevention, and education. And the state can take leadership to be that partner with our communities, with our organizations to do that. We have to reverse the privatization of Medicaid, the issues that I've mentioned before, but also not only are people, Iowans, not being served and supports for the families, but those providers, being put in a position where they have to think about getting a loan to cover their payroll because they've not been reimbursed at a level that's going to support the level of care that they are providing. Closing down those mental health centers without a plan for supporting individuals in the community. We just went full circle back to the 1950s, 60s with the deinstitutionalization of mental health services. You've got to invest in supports in those communities for individuals to be able to thrive, to function, and to live quality of life. The types of things that I would look at investing in would be increasing the number of beds. We've got a shortage of mental health care professionals, so let's put in place some type of incentive for students to get involved in getting education so that we have a pool. Ask for them to, in fact, require a commitment of 2 to 3 years of service for us in order to be able to do that.
Thank you. They say that money makes the world go round. Definitely it will make all of your fine plans go round. We're going to start this time with Nate Bolton and go down the line. Tell us how you're going to pay for your plans, and if you want to raise the mental health levy, the dollar mental health property tax levy, let us know about that. If you are going to reverse the privatization of managed care, let us know how you're going to control the costs.
Great question, and it's one thing that as someone who sits on the Appropriations Committee in the Iowa Senate, I spend a lot of time thinking about all the missing dollars that we have in our state. There's a real failure in this administration. We have gone through a manufactured budget crisis in this state. There is no excuse for us to go through rainy day funds, to go through mid-year budget cuts, to go through budget cuts that affected this current fiscal year, and then to come back this January and likely face $30 to $40 million in additional cuts at a time when our unemployment is at a 17-year low. Revenues last year to this year were up 1.3%. This is mismanagement of state resources. We have now over $500 million a year missing in our appropriations process. I am tired of hearing that we don't have the resources to put behind this problem. We do. We just haven't made it a priority. We've shut down 2 mental health institutes, and we've done nothing for the lost services, yet we've continued this giveaway system that has damaged our state budget.
Right. And I'm sorry, I didn't hear you say, would you raise the mental health levy, just quickly?
Certainly, I would give local governments the option to make their decisions on that.
Okay. Kathy Glosson, how would you pay for your plan?
Well, first of all, I'm a supporter of raising the minimum wage to $15 an hour. If we had higher wages for most working families in the state, the taxes that come into the state would be much better. We have had mismanagement of our state budget. This state had a surplus in the budget until the politicians that we have in Des Moines frittered that away and allowed business tax breaks to, over the last decade, we've doubled the business tax breaks that we give to companies that probably don't need it and doesn't benefit the people that I know and the Iowans that I care about, to the tune of $600 million annually. We absolutely have to take a look at what our priorities are, and those, for me as a governor, are to improve the standard of living for all Iowans, and that means actually funding the things we care about and prioritizing in a budget, which is health care, education, clean water, and to give Iowans the highest quality of life that they can have as a leader.
All right, thank you. Ron Corbett.
60-second elevator speech, right? I was in the legislature for 13 years, Speaker of the House for 5 years. During that time, we created the Hawkeye program. You know that program, Healthy and Well Kids in Iowa? We created that program to be sustainable. We created that program to be predictable, and it stood the test of time the last 20 years. Why? Because we just had a 3% administration fee in there. There wasn't any profit built in. It was a program designed for kids. And by the way, we put mental health services as part of Hawkeye. In the managed care system today, Kathy, you're getting 12 to 13% administrative cost, and the state still has their system, which is probably another 6 to 7%. So you have 19% administrative costs. There's ways to put the programs together, do it in a conservative way so they're sustainable, like Hawkeye.
Okay, thank you. Fred Hubble, how do you pay? Raise the county levy? Or how do you pay managed costs under managed care, unprivatized managed care?
Thank you. Well, first of all, we have a serious budget problem in our state. We've gone from a massive surplus to a sizable deficit because of this administration and this legislature's bad fiscal management. If we do a better job of that, that frees up a lot of money to be able to spend on education, health care, and getting incomes rising. More specifically, right now we have a very expensive mental health system. The jails and the emergency rooms are the most expensive place for these people to be, and they get the worst service. So if we have much better diversion programs, much more community-based programs where local communities can decide what services they need to provide the best sources of treatment and support for the people that need it, whether substance abuse or mental health, we can save a lot of money. We've in fact seen that. In my travels around the state, in Johnson County, in Story County, and in Polk County, they are saving money by having good programs up front.
All right, thank you. Ms. McGuire.
Thank you, Kathy. Well, I think we need to hold the opioid manufacturers responsible for what the crisis that they have caused. So I would work with our Attorney General, Tom Miller, to make sure that we join in the suits that other states have done and make sure the proceeds from that go towards our mental health problems, substance abuse and addiction. I also would go to treatment rather than prison and jails. It's 5 to 6 times less expensive to treat someone than it is to put them in jail. And that's a way we could use those resources to treat even more people. We do need to raise the levy so that people locally can get the community health resources they determine they need. I think it's always about local. And then we cannot wait, folks. This is not going to get less expensive. It's going to get more expensive. It's a crisis. We can't afford to wait.
Thank you. John Niederbach.
We should raise the levy this session as a short-term measure, but I fail to see how property tax is the appropriate way of funding mental health. There's no linkage between the value of a property or the property itself and mental health problems. We need to make this a statewide funded program, just like all other kinds of health. I've proposed legalizing cannabis to raise $200 million. That would give a big shot of improvement and new money into the mental health and substance abuse system. I agree with Andy about going after the manufacturers of the opioids that have caused so much problem with very bad marketing, very inaccurate marketing. I think in terms of cost containment, an effective case management program, not what is being done with privatization. Ron Corbett's numbers were very, very on point. We need to repeal the privatization, but have an effective case management program that puts patients first, but still contains costs.
That's time. Thank you. John Norris.
I think it's important to recognize this is not just a spending to solve the problem issue. We have to have a connection between an overall strategy and then a funding source to enact that strategy. We lack both right now. We have an antiquated funding formula with the freeze on levy rates back to the 1996 level. I believe we should have each region be able to, with state oversight and a statewide strategy, develop the plans for that region, and then empower local government, imagine that, to set a levy rate that meets the strategy and implementation of that plan. That'll also help attract much-needed professionals. People who want to serve and help people want to be a part of a system they can be successful in. They don't feel they can be successful in our system today, and we're having a hard time attracting professionals. And by making the wise investment, we save so much from ERs, from the cost to law enforcement, with early intervention, especially for children's health care. We know if we catch this early, we'll have productive tax-paying citizens who today are not in that path, and we can get them in that pathway.
Thank you. Jake Porter.
I think the idea that we are somehow saving money right now by not funding mental health is laughable. We're actually spending more money. We are basically transferring the cost of dealing with mental health onto the prison system, onto the local governments. There's no savings as far as your tax dollars go doing it this way. It costs about, I think, around $33,000 a year to imprison someone. It costs a lot less if we're going to start to get people the help they need. If we start treating things like drug addiction as mental health issues instead of crimes, that's one way we can do this. And we've also got to look at our budget. The corporate tax breaks that we give. We have companies here in Iowa that not only do not pay taxes, big, large companies, they get money from the state of Iowa, and they pass the tax bill on to us, and then they say, well, we can't fund anything that we might actually save money with later on. So I find that all laughable.
Thank you. Stephen Ray.
Well, 30 years in government, and I can tell you 22 of it with the state of Iowa before I left August, my position in August to run for governor. A lot of abuse and waste, in my opinion, in state government. And that's why I believe strongly that we can reprioritize our budget to help the mental health issue that we need to pay for. As governor, I would empower the local governments to raise the levy and ask the legislature to give that permission to them. I think it's critical for our local governments to be involved in that. As a council member in my community for the last 14 years, I know what kind of strain it has on local budgets, seeing what happens at the county level, and we've got to allow that kind of funding stream. But the main point here is the state of Iowa has to play a key role, an absolute key role in mental health, and that's what we're going to do if I'm governor.
Thank you. Brent Roski.
You know, in this country, we expect some things. We expect protection from the police department. We expect a fire department. We expect public schools K through 12, but we don't expect health care. You know, in Kathy's article, she was talking about the very tragic story of the folks in the front row, and I'm so happy you're here tonight. One of the things you mentioned, Kathy, was insurance wasn't there for them. They spent more than 4 years of college for the treatment for their son in other states, and that's just unacceptable. It's not okay to shrug your shoulders and say, how are we going to pay for it, and have that make the problem go away. I directed the West Wing cast for Justice for Vets. It's all about veterans treatment courts, because they looked at not only as the right thing to do, it's a cost savings. You've heard Jake was right on, 30 grand a year to put somebody in jail. We need to look at this as something that we expect, just like police, fire, K through 12. It's the benefit of citizenship, and it has to be addressed now.
Thank you. Russ Wilburn.
I would be willing to raise the levy within the context of an overall strategic plan, pulling together folks from the Department of Human Services, Health, Human Rights, Department of Education, as well as some of the advocate groups like NAMI out there. There are some things that don't necessarily have a large or a financial cost in terms of like rethinking some of the regional approach. I mean, there are some counties that have a different need than others. If one county is saying, let's address housing for folks with mental illness, and others looking at doing things like mobile crisis care centers, those types of things, there may not be quite the cost. There are existing plans out there, things that will help address this. You know, the Iowa Justice Action Network talked about some of the recommendations, the work they've done, reducing incarceration, increasing treatment for mental ill with those addicted to drugs, eliminating mandatory minimum sentencing, expanding other alternatives like drug courts and those mobile crisis cares, but also even just using universal assessment when people are coming to emergency rooms. Those types of things will help.
Thank you. And last but not least, Marco Battaglia.
I believe that it was a grave mistake to tie mental health funding to property taxes. I think we need to work against that right away. I think it's a public safety issue, and we should fund it transparently and directly in the budget as mental health. We know that spending money and taxing does not always solve problems. We have to work smarter. If throwing money at a problem helped all the time, we'd have the best health care and the best, some of the greatest education on the planet. So we know there's other things we can do. We know that John mentioned reining in the war on drugs would open up a market for cannabis, but there's also psilocybin, MDMA, ayahuasca, ibogaine, kratom. There's all kinds of substances that are being proven time and time again to help people when they work with the doctor and use these kinds of things. So there's a world of things we can do here.
Thank you. And Tony.
Thank you. Several of you have alluded to this. The state closed 2 of its 4 mental hospitals at Clarinda and Mount Pleasant in 2015. Supporters of the closures noted that in their heyday, the 4 facilities housed up to 6,000 patients at a time in the 1940s and 50s, but those numbers had dwindled to a few hundred by the time they closed. Would you reopen one or both of those hospitals? And if not, how would you address the need? We're going to start with Ms. Glasson.
Yes.
Well, that'll save some time. Mr. Corbett.
I support the effort to deinstitutionalize people in community base, but oftentimes in public policy, the pendulum can swing too far in one direction, and the top-down decision that really didn't include much input from Iowans, from providers, from people that using the service, swung the pendulum a little bit too far. So I think we need to add back some beds in the system, maybe 25 to 50 beds, and then have a little discussion of what type of beds to take a little bit of pressure to relieve the compression that was created, and just swing that pendulum back a little bit more, but I'm still in favor of community-based over state institutions.
Thank you. Mr. Hubble.
Yes, thank you. I think by far the best solution for the beds is to have community-based support services. Local people know their needs. Local people know what resources they need. Let's empower them to make the decisions. On top of that, we are going to need some long-term acute care beds, probably I would say in the neighborhood of 50 to 75. Should they go in those 2 mental health institutes that were closed? Let's remember, they are used now by the Department of Corrections for prison support. So they're already being used. So if we're going to convert them to mental health, where are those people going to go? It's just creating another crisis. So the solution needs to be, we need 50 to 75 more long-term acute care beds. Let's do a study to figure out where they should be, because they should be as close to the location where more people have these needs, so they don't have to travel as far to get to one of these locations. But most of the beds, most of the treatment, most of the service needs to be community-based, where people who live in the community can help to make those decisions the best.
Thank you. Ms. McGuire?
As a doctor, I'm sure many of you that work in the field know this is a complex issue. Acute care beds is not the only beds we're talking about. There are transition beds, there are long-term beds, and we have a real problem right now with, we don't have enough acute care beds, but honestly, we don't have anywhere for people to go who can't go home after they're done with their acute care, and the medicines haven't quite worked yet. You all know the problem, and so this is a cascading issue. And that's why I feel like with my experience, I can bring a solution to this. We have to talk about more acute beds. We have to talk about more medium-length beds. We have to talk about community-based long-term beds. We have to talk about the whole system. And then we have to talk about community-based structure. And we have to talk about how do we get people to those beds. Right now, we're going to the emergency rooms, not the best place in the world. We have to have places where people can go to get the outpatient care and or inpatient care that they need. And that's why I've written a plan so that we can do those sort of solutions right here in Iowa.
Thanks. Mr. Neidbach, what would you do about the state hospitals?
Well, closing the 2 facilities was a stupid decision. There's no other way to say it. It was really, really foolish because there was no thoughtful plan on what to do with the people, how to meet that unmet need. And also, of all the places you closed, those 2 facilities were shared campuses and therefore were relatively cost effective because they were sharing the costs with the Department of Corrections. I used to be knee deep in the Human Services budget, so it was really a foolish idea. Going forward, it's entirely possible those physical facilities would be used again because there is a shortage still of acute beds. But as Andy said, the biggest shortage we have is chronic needs that go on for a long period of time, community-based chronic beds, and that's what we need to focus on.
Thank you. Mr. Norris?
Thanks for the question, because the closing of the institutions kind of become the campaign trail, my colleagues may agree, as the proxy for our serious mental health crisis. But it goes way beyond just reopening the institutions for acute care. And we should always strive to enable people with mental health illness to reach their highest level of living. And so I think focusing on community-based care, expanding beds for different levels of care, if we do reopen an institution, make sure there are different levels of care within that institution. I want to applaud Cass County and Atlantic for their decision to keep their behavioral health unit open with 4 beds. There's one in Storm Lake as well. I think we need to look at our critical care access hospitals across this state. Cass County is losing money in their operation. We need to make sure they can be able to at least break even in those operations and expand the access across this state for beds at different levels of care, utilizing our existing infrastructure of hospitals across this state.
Thank you. Mr. Porter?
In 2015, I remember when this had happened, the Branstad administration said at that time it was, we should let the nonprofits deal with this issue, right? Well, okay, are there any nonprofits dealing with the issue right at this point? No, and it's been a disaster, it's been a failure. So would I have done that? Absolutely not. But the fact is that it has been done, and so as far as opening up these facilities again, as Fred points out, they're being used. They may not even be the best locations for facilities that we would use as well. So we would have to look at that and also focus, as many people have mentioned here, on making sure this is done at the local level and not the state. Things are going to change rapidly. Population, people move into different areas, they leave different areas, so that's all going to change as well. So it needs to be done at the local area. That way we can make sure that we're getting people the help that they need.
Thank you. Mr. Ray?
I would not be in favor of using the current facilities. mainly because I think one of our biggest issues we need to deal with is getting away with this idea of institutionalizing this issue. They're big, imposing buildings. I think what my idea of a community-based, regional type solution to this, which of course will cost money for infrastructure, but certainly your more populated areas may need to have something in each county. More rural counties could go together and have a regional base, but I envision something that's open and bright and as a clinical type setting for both inpatient and outpatient treatment. And that is my overall vision of how I'd like to see this played out.
Thank you. Mr. Roski?
I'll echo Kathy's answer that yes, I'd like to reopen them, if nothing else, to be a base for in-home care and for institutional care. What you're looking at, though, folks, is a whole lineup of people who know that this is an issue. The governor doesn't seem to think it's an issue. 40 to 60% of inmates in Iowa jails have some sort of mental illness. 40 to 60%. About half of the folks in Iowa jails right now have some sort of mental illness. And Kathy's article actually says that I have not heard Governor Reynolds make mental health a priority on par with tax reform or workforce development. So 11 months from now when you're voting, vote for one of us if this is an important issue for you.
Thank you. Mr. Wilburn?
I would be willing to open them again within the context of a plan, also within the context of that 4-tier that I talked about earlier, prevention, treatment, intervention, and education. I think also tied with criminal justice reform, and the emphasis being on those community-based services. Again, we want to try and create the opportunity for people to live in the community, live with their families. Sometimes people will need that extra support, and but as part of that intervention to have those acute beds open. But we've got someone in the audience tonight that even passed out some information about assisted outpatient treatment under court order, those types of alternatives. But even, I remember again at the crisis center where we used to go out and advocate in emergency centers, but now my understanding is they're moving towards even those mobile things where you bring the care to where people are before they go into treatment.
Thank you. Mr. Battaglia, what would you do?
It does really bother me that it seems like our governor is happy to be the protege of the last administration when it's a really easy topic where she thinks she'll get applause. But then when it's something like this issue where they've done a lot of harm to Iowans, then they kind of distance themselves from each other. But we don't have to look very far for hope. Our neighbors in Minnesota and in South Dakota are among the best places to be in the world if you are having a mental health problem. So I think we need to start a task force like they did, and really we would reopen coverage in that area, maybe not the same facility, but I think also we bash private institutions a lot, but it was really the Quakers starting private mental health care that moved us away from this once flew over the cuckoo nest sort of setting to something where we treat people with compassion and treat them like they can heal themselves.
Thank you. And Mr. Bolton, what would you do?
Thank you. First of all, I think it's very offensive to say that these facilities were not providing quality services or somehow were warehousing people. I think it's offensive to the resident treatment workers who poured their careers into services for some of the most severe cases of mental illness in our state, and it's offensive to the facilities that are still open providing that care. I visited the facilities in Cherokee, I visited the facility in Independence, and I've talked with the people working in those facilities. They're working hard to make sure people get the care that they need. They will get calls in a single day that if they kicked everybody out of those facilities and housed everyone that called in, they still wouldn't have room. There is a critical need for those services, and to demonize the people providing those services is simply wrong. I'm proud as an attorney to have gone to the Iowa Supreme Court and argued to keep those facilities open. I'm proud as a legislator to have introduced legislation that would have forced reopening and maintaining 4 regional facilities, and I will be proud to fight for that as governor.
Thank you. The next question will start with Mr. Corbett.
Iowa faces a critical shortage of mental health providers. The state ranks among the lowest in the nation for the number of psychiatrists and psychologists per capita. What would you do as governor to ensure better access to providers for Iowans in all 99 counties?
Clearly, we have to have some incentives for the whole pyramid of caregivers, from the top of the pyramid, which is the psychiatrists, trying to get more people to go into the field and stay into the field. But it isn't just exclusively the psychiatrists at the top of the pyramid, nurse practitioners and other healthcare providers. My real concern is, as the managed care organizations have reduced the reimbursement rates, the frontline providers now, these are some entry-level social workers, they can go work at Hy-Vee or Walmart or Come and Go or Casey's at a higher wage rate than they can at their current facility, and so they're seeing a lot of turnover, and that's not going to solve our problem. So we do need to look at the reimbursement rates, so we're not strapping the existing providers, and also focusing on incentives to get people encouraged into this profession.
Thank you. Mr. Hubble.
Thank you. This is one of the biggest problems that we have with mental health and substance abuse in our state. We rank almost at the bottom across all the states in our country. We need to reverse the privatization of Medicaid, because a lot of providers are not willing to take on Medicaid patients these days because they're not being paid on a timely basis and they're not being paid adequately. So if we keep encouraging them to get out of supporting our mental health people who are using Medicaid, then we have a problem. So we need to reverse that privatization. Secondly, we need to increase and encourage more residency programs in this state to encourage more people to actually start to learn and experience mental health, counseling, psychology, psychiatry in the state. And we're going to need to have loan forgiveness programs. Right now we have a loan forgiveness program for general practitioners, but we do not have a loan forgiveness program for psychiatrists and psychologists and trained clinical physicians. That's what we need in this state. So when we graduate people who have that skill, they want to work in our state, and they commit to work here for 5 years, and we repay a good part of their loan.
Thank you. And Andy McGuire.
Well, thank you. You know, I think we need a short-term and a long-term solution. Short-term, we need to get our prescribers, our general practitioners, our mental health providers all over the state more training so that they can take care of patients with backup by psychologists and psychologists and psychiatrists by telemedicine, so that we can attack this problem immediately. Then we need to have incentives, such as loan forgiveness, for the great people who go into mental health practitioners. You know, I see some mental health practitioners that I know in the audience. And you know why they go into this? Because they have a passion for helping patients. And we need to make sure that they're not having crippling debt, that we can have loan forgiveness for them, and that they can go to underserved areas, such as rural areas, and they can care for patients. That's what they want to do, and we ought to be helping them so that we can have a long-term and a short-term solution to this problem.
Thank you. John Niederbach.
Loan forgiveness needs to be expanded. There is a federal program currently. I'm nervous whether or not it's going to withstand the tax, quote, reform, unquote, that's being pushed. There have been some changes to, I think there's a difference between the House and the Senate bill on that right now. We'll see how that boils out. This is one area also where the locations are really, really important. It is harder, quite honestly, to get some folks to move, highly trained people to move to some of the more rural areas where the MHIs are and were. So that is an issue that has to be factored in, whether or not you want to keep the MHIs in the current locations, particularly Mount Pleasant, if you wanted to reopen them in Mount Pleasant and Clarinda. Not saying you shouldn't, but you have to factor that in. Bottom line, people go where the resources are. It's really, I'm not going to say it's 100% a question of money, but largely.
Thank you. John Norris.
As I already stated, reversing the privatization of Medicaid is key so we get adequate reimbursement rates so people can actually get compensated and healthcare facilities can get compensated for the services they provide. Step number one. Having an overall strategy about what we're trying to achieve in an environment in which health professionals can be successful is critical for being able to attract healthcare professionals. We have an opportunity in Iowa. We're a very stable population. We should strive to be a center of research. Because of our stable population, researchers can spend more time learning about successes of different ways to treat mental illness. That helps draw professionals here too. Let's strive to be a place where researchers and mental health professionals want to be, with adequate reimbursement rates, with a strategy and plan being implemented across this state that they can enable them to be successful in. Let's create the environment to be successful. We are not trying to create that environment today.
Thank you. Jake Porter, I'm going to reframe the question for you just a little bit. Would you support giving non-physicians, such as psychologists, more authority to prescribe psychiatric medications as a way to ease shortages? Or what else would you do to increase the number of mental health providers in Iowa?
Okay, yeah, I would consider that, but I think one of the things we've got to look at, though, is also our small towns and small communities are dying. Like the last census, 77 out of 99 counties lost population. That's not encouraging for people to relocate to these local communities. We've got to have a plan to actually revitalize our local communities, make sure that we're not sending all the jobs, all the businesses, out of state like we like to do with our tax policy or our regulatory policy. For that, another thing also we would have to do would be to reverse the privatization that occurred for Medicaid. So those are some of the things we can do. And I think also, as long as we're talking about the issues of mental health, that will attract more people to get involved in these areas. Once we kind of reverse that stigma around it, that it will, more people will eventually get involved in it. But the government's, we can't offer, a quick solution. That this governor's not going to offer something that's going to solve all the issues overnight, that's for sure. And we should also look, as I think Dr. McGuire mentioned, for telemedicine as well.
Thank you. Stephen Ray, would you let non-physicians like psychologists prescribe drugs a little bit more freely than they can now? And what else would you do to increase providers in the state?
Yeah, I would certainly entertain that option. And I also believe that the reversal of the privatization is a key issue here, to draw more people here that are going to be able to have the expertise in this area that we're having a struggle with now. And I believe it was one of the Des Moines Register columnists recently had written an article regarding what the former Governor Ray did years ago in the 70s, trying to get more rural doctors to come to Iowa, and that contributed to a loan forgiveness. So I think if that worked back then, I think that's something that we could certainly entertain again. And I'm also extremely concerned about the lack of child psychiatrists that are out there. We hardly have any that are in that area of expertise, and we really need to concentrate on that too.
Thank you. Brent Roski.
Enticing medical professionals to Iowa touches on a bigger issue, which is making Iowa more of a magnet to retain the talent we already have. If you look at the graduating classes, University of Iowa, Iowa State, less than half plan on sticking around. They don't feel like they're going to be participating in the grand, majestic tapestry of life if they stay in Iowa. We need to change that. We need more culture. We need more funding for culture. The governor brought Apple to Iowa, the data centers building in Iowa. I actually don't think it was a bad move. I think it's a good move. Eventually, we're going to need money to pay for things like increased mental health. The Apple data center is one way to possibly get that funding. If we can figure out how to bring Apple to Iowa, certainly we can figure out a way to entice more mental health and health professionals to make their home here.
Thank you. Russ Wilburn.
As you tweak the question, I would say yes, under the guidance of licensure and education and oversight. But in terms of just the number, that Grow Iowa incentive to get a commitment, 2 to 3 year commitment for folks to get that, not only the help to get into the profession, but to try and get a connection with community, I think is important, and connection with understanding who's in the area, the county that you're in, as well as working with parents, individuals, and support groups. But education for all of us is a role that the governor's office can take in terms of recognition, understanding, use of paraprofessionals. Again, just the premise of your tweaking, going back to medication, there are other areas that paraprofessionals can help in terms of intervention, respite, and support.
Thank you. Mr. Battaglia.
I believe that we can refocus the training that we already give to Iowans and really refocus it towards jobs that we're going to need in Iowa for the next 100 years. I don't know how much money we waste there, how much foolishness goes on there. I think medical professionals and mental health professionals are high on that list, if not, number one. We need to let doctors do their job, let them have more time with their patients, let them treat their patients with medicine that they know works. We currently schedule and prohibit a number of things that are working. We say we love science, give more money to the sciences, but some of these policies are the most anti-scientific thing available. We need to let citizens have medical freedom to decide what is safe and effective to treat their problems.
Thank you. Nate Bolton, do you let more non-physicians prescribe? And what else would you do to expand the workforce for mental health providers in Iowa?
Yeah, we've had some good suggestions here. I think we do want to have more mental health professionals out there and more access to mental health professionals, especially in rural Iowa. And part of that is using loan forgiveness or other programs to entice people into those settings and into those professions. In terms of the scope of practice, I do think making sure people can have access to providers of care and get the treatment that they need and the medications that they need is important. So I do support the expanded scope of practice, but I also want to make sure we do it in a safe way that does not compromise patient safety. I don't want to see the next step be finding ways for less and less qualified individuals to be on the front lines of mental health care. We've seen too much of that in emergency care with police officers and firefighters and corrections officers becoming mental health counselors. We want to make sure we have quality psychiatrists, psychologists in our communities.
Thank you. And Kathy Glasson, more authority to prescribe for non-physicians, and what else would you do?
I agree. We would need to evaluate for the professional psychologist being able to prescribe. I think that would have to be handled carefully. We have a problem with licensed professionals that can prescribe now, and we should focus on the core issue. But if we needed to actually look at that, I would support it, but as long as it was a safe and went through the boards and licensure process that the state has. As far as how to attract medical and behavioral health, mental health providers, the very first thing we need to do is make sure that those providers are reimbursed, and that's not happening under the current privatized Medicaid system. So we need to first reverse the Medicaid system so that providers are paid. Reciprocal licensing could occur between states so that if you're a psychiatrist or a counselor and you want to practice in the state of Iowa, when we're looking for folks, the state should allow reciprocal licensing so they can practice here in Iowa. Again, I support the loan forgiveness to encourage folks to study here, work here, and then have loans forgiven. And then also, I think we also need state-of-the-art facilities. We talked about reopening some of the closed mental health facilities. Those need to be state-of-the-art to attract the professionals that we want to have here to provide the care to Iowans.
Thank you. This is one of those ones where everyone agrees it's a problem, but we're looking for specifics about what people would do about it. What specifically would you do to prevent people from being jailed or imprisoned for behaviors that stem from mental illness or addiction? And we'll start with Mr. Hubble.
Thank you. That's one of the biggest opportunities we have to provide better treatment for people with substance abuse and mental health issues and to save the state or the county a lot of money. There are examples across our state in Polk County, Story County, Johnson County, where they have excellent crisis intervention training for their police people. They're on the street, so oftentimes they're the first responder when there's an issue with somebody that has a mental illness. They go out and determine what it is, and they can oftentimes divert them right away out of the jail system into a community-based program. If not, then they bring them into the jail, and they're already prepared to start providing the kind of support that they need as a mental health person rather than as a convict. So that's a very big opportunity in our state. Prevention, identification, the earliest we can do that, the better treatment that they get, and the more money that the state can save, because it reduces recidivism by quite substantial rates. So prevention, early identification, and treatment, and training of the police people and the emergency response folks on the street, so that they can identify crisis right there and deal with it before it actually gets into the police station. Thank you.
Ms. McGuire, what would you do?
I've studied some of the programs that have gone on in other areas, and there's a program in Seattle that is a diversion program, somewhat like a drug court, except that you divert them before they're actually in the system. And this program saves money. It's about a fifth to sixth times less money of incarcerating people. They don't have a record, and it's 60% more effective for people to not be going back to jail. So this is the kind of program where we keep them from having a record, we treat them as patients, which is what they are. They have a disease, we treat that disease, we get them back on their feet and back into the community. That's the kind of specific program I would do to try to help these people.
Thank you. Mr. Niederbach?
Frankly, I think Fred and Andy covered the waterfront pretty well on that. There are existing programs that are working well around the country and in Iowa. We just need to make sure they are out there in every county around Iowa adequately funded. I don't think this is one where we have a lot of problem figuring out what to do. The problem is making sure that we're actually doing it. Also, I think we need to make sure we're not incarcerating folks for medical problems like addiction. That is a medical problem and needs to be dealt with primarily from a medical model.
Thank you. Mr. Norris?
I have to remember, most mental health illness is predictable. And it's getting out front of it with prevention that minimizes the need of as many crisis situations as we have. So the more services we have, the more levels of services we have, the greater job we can do of preventing crisis situations. We do, it's one of the few things I think I would say we do well in Iowa right now, not that we can't do more, is the training of law enforcement and other EMTs about how to handle those crisis situations so they don't escalate into criminal activity. That's a critical juncture where we can help keep people from long-term problems. And continuing training for law enforcement officers and more crisis intervention teams to be able to intersect before the law enforcement officers have to engage to de-escalate and avoid the crisis situation.
Thank you. Mr. Porter, what could the state do on this?
You know, there are things we can look at as far as training programs that were mentioned, but I think one of the things that people here are missing is criminal justice reform. We look at it, so we are sending people right now to prison for victimless crimes. We make it to where they find it impossible to get a criminal record. We make it impossible for them to find work later on. They end up back in jail. They end up turning to drugs. And then it can we have this cycle going on and on and on. Should we really be imprisoning people for something, as simple as marijuana possession? I don't think so. I think we also need to look at, finding the problems earlier on with mental health. That way it doesn't get to this point of where we're looking at imprisoning people. But I think that's one of the key things to look at too is how we have, criminal justice reform, and are we putting in prison, should they even be there?
Thank you. Mr. Ray?
Well, I'm pretty confident in saying that a majority of our law enforcement officials are pretty good at understanding human behavior. It's what they do every day. The problem is that we, again, as we've talked about tonight, we have failed to give them the tools to deal with it. If you go on a call and you've got somebody that is dealing with a mental health issue, and you take them to a vast majority of our county hospitals, they're not even they're not even equipped to deal with that. I've talked to many hospital administrators that say we're not even equipped to deal with that here. In fact, they would prefer that they would go to a larger facility. So again, this boils down to that we do not have the tools available for law enforcement to deal with the issue, and that's where the state needs to step up and do something about it.
Thank you. Mr. Rasky, what would you do?
Let's look at some statistics for crime in Iowa. Did you know that Iowa is only one of 2 states nationally that saw an increase in all 4 categories of violent crime over the last decade? From 2006 to 2016, we saw an 8% increase in violent crime, 27% increase in arrests. Well, if we're one of only 2 states nationally that saw an increase in all that, and we're at dead last for lack of mental health beds, and as I mentioned earlier, 40 to 60% of our inmates have some sort of mental illness, the correlation is obvious. So some of the solutions presented here tonight are fine. with Justice for Vets, we use Veterans Treatment Courts to keep veterans out of prison. Here it's the same sort of thing. They need to be treated as mental health patients and not simple criminals. It's $76 million a year Iowa spends on prisoners, half of which have a mental illness.
Thank you. Mr. Wilburn, what would you do?
If you could restate the full question there.
What specifically would you do to prevent so many people from going to jail and prison for behaviors that are related to mental illness or addiction instead of violence against other people?
Thank you. I'll refer again to the items that I mentioned earlier in terms of things like drug court, the mobile crisis team. And if you've never heard of the concept, it's really you are bringing the mental health professionals out in the community. So if someone's at a mall or a business and there seems to be something you don't quite understand the behavior from someone, so it brings folks out to them and not just law enforcement, even though they do a nice job with what training they do have. But let's bring some mental health professionals into it. Also, I will refer to those that criminal justice efforts that I talked about earlier, expanding alternatives to imprisonment for nonviolent offenders, reducing incarceration, increasing treatment, those types of things, and always training. And then going back to, again, just as a state, as a society, let's look at prevention, intervention, treatment, and education, and recognize we all have a role, not just the state.
Thank you. Mr. Battaglia?
This issue is personal to me. I've lost friends and family, and I'm sure everyone in here really has. I'm going to keep saying it till Election Day. Broken record, rein in the war on drugs. It's a failure. At its root, it was racist and based on propaganda. We need to reduce the number of nonviolent crimes on the books. What causes a lot of these problems? Depression, anxiety, poor nutrition, economics are a factor. We need to return to sound money and to sound economic principles. I mean, this is why people join gangs, largely why they become terrorists in other parts of the world or domestically. We also need to look at it in terms of nutrition. Right now we subsidize monoculture that is low nutrient foods, and if we free the agricultural market, farmers will grow more nutrient-rich foods in a freer market. I really believe that.
Thank you. Mr. Bolton, what would you do about criminalization of mental illness?
Well, first of all, I think the whole forum up to this point has been about sharing those ideas to prevent law enforcement from interacting with persons with mental illness unnecessarily. So I think when we talk about reopening mental health institutes, expanding the scope of practice and doing things to reverse the privatization of Medicaid, to get community-based care active again in our communities, that's really what we're talking about. But I also want to talk about something in terms of what happens after someone is interacting with law enforcement. When we talk about our diversion programs and our court system, we need those programs to succeed, to make sure persons with mental illness that are incarcerated or jailed unnecessarily or have substance abuse problems are able to make that transition. And we need to make sure that the racial disparities in those programs are addressed as well, so everyone has access to those diversion programs. And finally, I want to mention that we also need to make sure we have quality law enforcement in our streets. We have quality EMTs in our streets. We have quality firefighters. We've diminished those roles in public safety in this last year with a degrading public sector bargaining bill. We have to ask ourselves where the next generation, those frontline providers, are going to come from.
Thank you. Ms. Glosson, what would you do?
Well, by the time someone that has mental health or behavioral health issues is in contact with someone from law enforcement, they need acute intervention, and that is only going to happen with crisis stabilization centers that would be located around the state, and having access to acute beds like the 2 facilities that we have closed. Also, I agree that if we address the economic instability of families and poverty, that's a good first start in the prevention phase. If we address it front on and early, we actually would reduce the number of folks that actually get to the point where it becomes acute. And then also the education of law enforcement and making sure that we have adequate providers to provide services to folks before they end up in a jail is critical, and that's prevention and making sure that the acute treatment is there immediately so that they don't continue to spiral downward and have more problems later on and end up in a jail that they should never have been in the first place.
Thank you. Mr. Corbett, what would you do?
Thank you. Well, we know treatment works, and we know prevention is the best way. So as challenging as the adult system is and the correction system is, at least there's somewhat of a process for people. But for our kiddos, there really isn't. And so many parents really have no place to turn to or don't know even where to turn to. And many of our teachers really don't feel equipped. There are some great organizations and people working hard. Foundation 2 in Cedar Rapids has a crisis hotline and a crisis team. They're trained professionals in mental health. They're not law enforcement officers, so they're the first ones on the scene. I think we need to utilize our area education agencies more to help our teachers and principals and those at that early level when they're looking at screening and assessing kids at those very early ages.
Thanks, Mr. Corbett. That actually, you started answering what's going to be our last question. People have agreed for years that this state doesn't have a system for children's mental health, and there's been a million commissions. There's several people in this audience who've sat on those commissions. Why has it been so hard to get that going, and what would you all do to get it started? What would you do first? Ms. McGuire, we're going to start with you.
Well, the first place I'd start is with our schools. On my plan, I recommend that we have a school a mental health and substance abuse counselor in every school district to try to work with our teachers and with our nurses to really address the problem with our children. You know, so many of them, of our mental illness starts by the age of 14. And that's when we should be talking to them and getting them treatment early so that they can have great lives. There are treatments for mental illness. Remember, it's a disease. Same for substance abuse. We do have treatments for these. And if we had more resources for those children, I think that would be a great start. The other thing you have to do is arm our teachers and have them get more training so that they can be our resource for our kids. You know, they can work with the parents so that we can unburden the school and try to get this taken care of as the disease it is.
Thank you. Mr. Neidbach, what would you do?
I think a couple of years ago we were starting to make some pretty good progress in terms of services as Medicaid money was flowing into the schools, but we've really lost a lot of ground recently with the very poor funding for education. We need to rectify that and make sure that the resources are in our schools with trained professionals that know how to help students who are experiencing mental illness. The other thing, though, really is a more coordinated system. Right now it is so fragmented, and so much of the responsibility, quite honestly, falls upon the parent, and it's overwhelming for a lot of parents. We need a better sense of case management, people who can actually try and make sure that the community resources integrate well with the school resources.
Thank you. Mr. Norris, what's been preventing the state from making improvements in this? Everybody's been agreeing for years it's a problem. I'm sorry, what's been preventing the state from making significant improvements on this? Everybody seems to agree that it's a problem.
Lack of will, leadership. I mean, that's what it takes. We've got a system that just ignores children in our mental health delivery system. There's no, how can we have a state that doesn't have a plan for children? And we don't. That's ultimately what this is. Now, I got to apologize. I caught myself in the last question talking. I've been briefed by so many and talked to so many healthcare professionals, mental health care professionals. I started talking like I was an expert on it. I'm not. You know, I thank the people, folks at Orchard Place, for briefing me on children's issues. I thank Dr. Paulson at the University of Iowa, who's an endowed chair of psychology and neurology, and my friend Dr. Peterson, and people across the state. The governor's job is to set the priority and get it done. And that's ultimately what we need. Leadership at the top that says, we have got to address children's mental health in this state. We are failing. Pull the team of experts together to get it done. Report back.
Mr. Porter, what would you do?
Well, I think for so long we've just ignored the issue and hoped that it would go away, but it's not went away. What do we see? I mean, suicide is, I think, the second leading cause of death between people ages 15 to 34 in the state of Iowa. That's a real problem. We don't address this, and we have to get back to, looking at the local community, obviously the teachers, the schools, the churches. Everyone really needs to be involved. That way we can catch the problems early on. We also need to know the signs to look for. And this isn't, something just a government solution that we're looking for. We're looking for solutions to everyone to be active in the community, everyone to help those that are in need, the children that are in need, and to do our best. It's multiple fronts that we have to hit it from, but it's not a one-size-fits-all. We've got to all do our part in this.
Thank you. And Mr. Ray?
Well, it does take leadership. There's no doubt about it. And we don't have much of that these days. And I will also say that there's a lot of issues going on in the news and in the public today where people are having the strength to speak out about a lot of things. And this is one area where we have to have people, including parents and family members, that are willing to say, no, that wouldn't be my kid. Open and talk about it and be willing to say that, there might be a problem here and we got to address it and hopefully at a very early age so that it can be addressed and that child can go on to grow up to an adult and get through those problems and realize that there's nothing to be ashamed of in getting that treatment. So I would certainly support more of a public education campaign on this to get people to talk about it more, because that's what we need to do as a society.
Thank you. Mr. Rasky?
If you're still curious about this issue, I encourage you to watch Dave Price's special on WHO. You can go to their website. It's called Mental State. In that, you'll see him interview Peggy Huppert. She's sitting right over there. She's with the National Alliance on Mental Illness. She says that, the money's being spent. Iowa is spending money on this, but they're actually spending it on jails. They're spending it on investigations of violence, but it needs to be spent on other ways. Adding beds for mental health patients is good, but it's not the only solution. Telehealth is a solution. 24-hour secure access for law enforcement, crisis intervention teams, but most importantly, we need someone with the political will to do it in the governor's office. I'll repeat what I said earlier. If this is an important issue to you, vote for somebody on the stage because the current administration doesn't see it as being as important as what it is.
Thank you. Mr. Wilburn, what would you do for kids' mental health?
It is leadership, but not just the governor's office. The legislative races are just as important. But I'm going to back up. You may have seen a little more philosophical approach. You may have seen on Facebook the advertisement for this. It was a picture, it said a young woman covering her face with her hands. Actually, the way I looked at it, because you could see the eyebrows were on top of the fingers, there's a face that we all have that we tell ourselves that this is the way you have to be, and if you are showing behavior that's a little different, we cause ourselves to cover our inner issues and our inner, that's the stigma. We reinforce the stigma on ourselves and our children, and so it's up to all of us to rethink that and use that education piece to recognize when someone is trouble, and let's reach out and require our governor and our legislators to address this.
Thank you. Mr. Battaglia?
As a media major from the University of Northern Iowa and a journalist, I really want to thank wholeheartedly Tony Lays, Kathy Obradovich, and Daniel Finney. I've read a lot of great stuff from all of those people over the years. A big thing is transparency in governance, in honesty. What do these kids see? A lot of do as I say and not as I do. And whether our officials are sexually harassing people or bullying each other, it's embarrassing, and this just say no mentality. I grew up in Des Moines. You get out of this just say no assembly, and then every drug imaginable is in the lockers next to yours. So it's not how it's going to work. I don't lie to my son about cannabis. I don't lie to him about hemp. We insult the intelligence of a lot of our youth. They can be learning languages and learning multiple instruments, but we're lying to them about far too many things as governance.
Thank you. Mr. Bolton?
When we talk about the situation with our children, it's a situation that is about to get much worse. As Congress fails to act on the Children's Health Insurance Program, CHIP funding, our Hawkeye program is at stake. I serve on the Hawkeye board here in Iowa. And I will tell you, we will run out of funds this spring and not have a Hawkeye program to give children access to critical services that they need in mental health as well as other healthcare situations if there is not attention brought to that very serious issue right in front of us. It's inexcusable there's not been action on that. We also need to talk about funding for our schools, because our teachers are an incredibly important asset in this process. Teachers are the ones who, in class sizes that are manageable, can identify those students that are showing indicators, that are showing signs that they're struggling, that are showing signs of mental illness. They're the ones that can direct them to the care that they need, to be that first voice that they need. And then finally, we need to get rid of the stigma associated with mental illness, so our children know that it's okay to speak up and say something and get the help they need.
Thank you. Ms. Glassen?
We absolutely need to invest in public education so that schools, communities, parents have the resources and support that they need. And I believe that we need to do more formal assessments and formalized screening for our students through school age, through high school, and into college. There's so many stressors for kids in a modern society that we live in, and all of the things that they're challenged by, that we absolutely need to do a better job of assessing. And then if we identify an issue, we need to make sure that the care is coordinated between healthcare providers, mental health providers, and behavioral health providers, so that our children have access to the best care as possible. And universal health care is the only way to make sure that parents and kids don't have to worry about how they're going to pay for their health care. If we took that pressure off families, it would make a huge difference, so that people aren't afraid to get the care they need. And we obviously have to destigmatize mental health and behavioral health issues.
Mr. Corbett?
When my mom was in her early 50s, she became addicted to crack cocaine. I was 32 years old, 33 years old, and had to deal with that as a young adult. When you're a young adult, you have ways of coping with that. But I wonder how I would have coped with it if I was 6 or 7 or 8. Probably not the same way I did at age 32. Adverse childhood experiences. There's ways to assess our young kids. You have to do two things. One, you have to bring the medical community in. Right now, I had 5 kids, taking them all to the doctor or pediatrician. What's the first thing they do? They measure their height, they step on the scale, they look in their ears, and they do that physical assessment. And then I'll go to the teachers' conference, and they'll say, well, your kid's able to read at this level, and they know their times tables all the way up to, 6. But really, there's nothing out there from a system standpoint to help the parents. So you bring in the medical community, as Kathy said, and others. There's ways to assess. And then you support the current infrastructure by using the AEA system. They do that now when it comes to people with physical disabilities. So there's as daunting as the task is, not just on the adult system and the correction system and the kiddos that we deal with. We can do it. I think we can.
Thanks.
We just can't get discouraged. There's a lot of criticism of the governor tonight because she's not here, or her leadership. But you can make change from the bottom up, and that's why we're all involved.
Thanks. Mr. Hubble?
Thank you. I think we need a governor and more legislators who have the courage to stand up and run state government on a long-term basis, rather than being focused on short-term results and special interests that are driving them to make very short-term, cost-conscious decisions. If we take a long-term approach, we would invest in prevention and identification of mental health and substance abuse at as early age as possible. We should have trained therapists and counselors in every school in this state, and we should be encouraging pediatricians and family physicians to get involved in a mental health screening process. They are not involved in that today. That should be part of their job. And if we had the right counselors in all of these schools, then the teachers wouldn't have to be doing this job. They could be teaching, and they could be referring the people who need the help right into the trained therapists and the counselors in every school across our state. but we need to take a long-term approach to prevention. It's the best way to treat the young youth, and it's the best way to save money for our state.
You guys have been really patient here, and I want you to now take the time to thank the candidates for being here. I also want to thank you guys. Thank you for being a really terrific audience. We will have coverage of this forum tonight on DesMoinesRegister.com. We'll also be posting video. You can also find the video of the program on Facebook Live. And we will have coverage also in print in Thursday's newspaper. I also want to thank the Iowa Hospital Association, our sponsor tonight, Des Moines University, our fantastic hosts, NAMI, the National Alliance for Mental Illness, and Peggy Huppert, and also the League of Women Voters, who have a table in the lobby. If you are not registered to vote, please stop by that table and get all the information you need. The primary is June 5th, and thank you very much.